I'd like to now introduce Yvette Menard. Yvette will be covering the most effective methods to handle email inquiries and turn those into revenue for your practice. Yvette?
Well, thank you again, and we'll get started. PUMC has been tracking on where practices across the U.S. are getting their inquiries that are coming in to be closed for consultations. And what we're finding is that the number is increasing. They're anywhere from 30 to 55%. So I think everyone here answered their very first poll question, which was, has your number of emails inquiries increased or decreased? And we had a 50-50 split, which was very interesting. We will be giving you some suggestions on how to increase your email inquiries. What we want to do is do a profile of your web shoppers. It doesn't matter if they closed or not closed. Just like you have basic data on your patients of record, you can answer these questions. We need to do this step for our web shoppers. What do they want? What are they asking about? Quantifying whether or not they were responding to a specific offer you made. How did they find you? Did they find you through a Google ad campaign? Did they find you through an Eblast? Did they just find you through a search? The next one is problematic. Are they repeat emailers? I call these our serial emailers. How many emails to close? How many email responses, and what did you have to do to close that inquiry? That's very important when you go back and you're talking next year about your budget, and in your budget you're talking about allocation of work and staff time. Then most certainly we need your results. Now this is important. It's a simple thing to do. Standardize your signature line and in your whatever, if you're using Outlook. If you're not using Outlook or a system set up with your database system, Outlook is the way to go, and it certainly will help with your email management. Now, why is this important? On each and every email you send out all the time, it's because you're trying to establish a relationship with the person that has emailed the practice. What you're doing is giving them your name and your title. They now have a name and a face with the practice. Why is this important? Because chances are they're just shopping more than one practice. So you'll need to remind them who you are. If you have your logo, if you have your tagline, your personal number, and your 800 number, all that is part of a standard email signature. Okay, answer the shopper questions. I know this is obvious, but in today's rush, haste, you may answer one question but not multiple questions, okay? So you want to take the time to do this. It's surprising to us, and when we're looking at some of the email responses, that people answer questions that aren't asked, particularly about risk. If the question isn't asked, don't answer it. And if it is, particularly one there's always questions, is it safe? Will it hurt me? You want to have some answers already pre-thought through. Talk with your physicians about this and make sure that that makes sense. Okay, so we do have a question, what if we don't do the new procedure or liposuction? Well, I'm going to cover that with you in a minute. Professionally designed e-blasts are important in the use of an outside company.